Awesome. Welcome, everybody, to the Dark Side of Therapy. My name is Justin. I'm the owner of the Greater Minnesota Trauma Center, licensed professional clinical counselor, certified family trauma professional, and a lot more titles. But I'm not going to say what those are because some of them are inappropriate. Just kidding. My co host is Eric Nance, licensed independent clinical social worker, certified personality disorder professional. I always mess that title up. What is CPD again?
Certified in personality disorder treatment. I
God, I'm
I sometimes wonder if you want to mess it up, just to mess with me.
yeah, no, I really truly I'm gonna write it down. I'm gonna write it down.
Thank you, Justin.
Welcome to today's episode. Some of you are probably really sick of me because Eric has graciously handed me over our social media page on Facebook, and so I've been trying to do some lives. And I think I'm funny. I really think I'm funny. Some people say I'm not. I don't really care, but I try to be funny on there. Eric was not napping yesterday. They had like 17 feet of snow up in North
That's right.
Dakota, and he was shoveling, so that's why he wasn't there. Uh, I don't know. Today,
Yeah.
what are
I
we what are we going to be talking today about today,
well
Eric?
okay. So before we jump into it, I just want to say
Yeah,
thank you for the episode with Michael Shermer. That what an amazing experience. And I don't know if you had as much fun as I did, but man, that guy is smart. And I honestly think we could have kept him on for like 3 or 4 hours. That wasn't going to happen, obviously. But it just to me, I just again, it was a really neat experience. Smart guy, isn't he?
yeah. I mean, when I watched the episode back at the end, we were like, okay, like we don't want to hold you. His response to you, in my opinion, was sort of like, oh, well, I'm having fun, but all right.
Yeah,
I
yeah.
think he probably could have kept going. So it'd be really cool to have him back on the show sometime. I really want to get into the conspiracy stuff though. You know me.
I know. Oh, I know. And he's one of the few people that just doesn't believe in like the JFK assassination conspiracies well, you know what his inside joke is? He says, "You know how I know that 9/11 wasn't an inside job? Because it worked."
Huh. But maybe that's why it was an inside job. Like it's
Mhm.
so crazy, and it did work. That how could it possibly be a conspiracy when it's right in your face? I think I would love for him to like pick me apart because I very much am a conspiracy kind of guy. Like I just think that things that happen that are so in your face and so blatant
Yeah.
is also a way of covering it up, right? Of making it seem like there's no way they could do it so blatantly obviously. That's just crazy. Yeah, is that crazy or is it crazier to think that your government is not doing shady shit behind our backs, right?
Yeah, but here's what Shermer's going to do. He's going to throw at you your confirmation bias. He's going to throw at you that your memory is not very good, and that really what you're doing is selecting the pieces that work for you. But yeah, I would pay to see that to happen to both of us. So yeah, I'd love to get it back on for that. But the point is, it was a great dialogue, and I'm surprised
Yep.
it went 90 minutes. I was like, holy shit. But yeah, it was really great. So again, thank you very much. Today it's Doctors of Social Media Part 2, Justin, and this is where you and I just go and look up questions that are floating around the internet. And on
Yes.
Quora, I love it because I love when the experts answer therapeutically. It's always very astute. They say things like, "Well, in my humble opinion, in my 35 years of research," I'm like, "Yeah, forget that. Let's just answer them straight up as two therapists here." So I got a bunch of them. I don't know if we'll get to all of them, but these are, I think, more fun than the last ones we asked. They're not going to require as much higher order thinking. They might, but I think it's
Well,
going to be a dynamite Q&A today.
I do have a question that I'll save maybe for like the middle to the end because it's a little controversial. But it's something I've been thinking about on my own for a long time as we've been doing this, and it's a question that has come up a lot in session. And so I've sort of just written it down, modified it a little bit, but it's a little bit of a controversial topic. So that one might require a little bit of thinking. So let's do some fun ones first, and then
All right.
depending on how you're, I told you an 11 a.m. time slot. I'm caffeinated. I'm feeling risky. So I'll try to tone that back for this first part.
You you do seem like today like somebody injected you with like caffeine darts or something.
Well, you know what happened was I had to go get an oil change this morning, and
Yeah.
I noticed on my Caribou app that I had a free coffee, and I haven't had coffee in like 3 weeks. So it was
Yes.
free. So I put 2 shots in here, and I got a large, and it's
Oh my.
gone. So that's what happened.
Well, okay. Well, I hope your blood vessels can take all that. Oh, Justin, it's going to be fun. So who wants to start us out today?
Go right on ahead. I want to see what your
All right.
questions are like first before I start asking.
You know what? That's the safe approach, but I like it. Um, so let's start with this one. What makes someone leave mental health therapy? What makes someone leave mental health therapy?
Ooh,
Yeah.
lots of reasons. I think, Eric. I think one of the common ones is um, they don't like what they're being told. They come to therapy. People. A lot of people, I think, come to therapy thinking, it's going to be a lot of um, a lot of, oh yeah, I could see why you would feel that way, and a lot of the feel goods, right? And if, I think
Mm-hmm.
depending on the therapist you get, yeah, you might get that. But if you want to make real progress, and I think maybe we talked a little bit with Dr. Schirmer about this.
Sure.
Uh,
Yeah.
that's why therapy isn't working, because we're just coddling people, um, and and so I think that a lot of times people leave therapy because they're being told what they don't want to hear, which
Right.
oftentimes is the truth and reality. But it's too much for them, right? They don't want to hear that. They need somebody to be on their side. Um,
Yes.
other times I think it's just life gets in the way and they're not seeing enough progress, right? That it's like, I mean, I've had some clients come in here in this week actually saying, I'm not sure if therapy's helping me.
Mm.
So why do I keep coming? And this week, I, I mean, I was getting a little irritated with those particular clients, and it
Yeah.
was like, is it because the therapy's not working, or is it because you're choosing not to do literally anything that we talk about? um,
Right.
you can't help the people that don't want to help themselves, right? So I think that's a big part of it is we have this maybe belief that if I come to therapy, all my problems are going to be solved. But no, I'm not some magic genie. As much as I wish, I have tools
That'd be
and
awesome.
skills and resources to give you, but I cannot wave a magic wand. And so I think people come in with this this belief
Notion.
that, yeah,
Yeah.
yeah, this
Yeah.
notion that, oh, I go see the therapist, I'm gonna feel great. No, you got to do the work, and if you're not doing the work, well, therapy's not working for me, so I'm out. I think those are
Do you,
probably top couple reasons.
and I agree with both of them. But I think you and I are very similar in that we believe, when a client comes to therapy, it's going to be your job to do the fixing, right? We're going to put
Yep.
the responsibility back on you. And I think, yeah, people don't want that because they're used to the medical model, which is, I go in, I get a shot or I get a medication, whatever. But you're going to come to work with us and we're going to say, okay, that's the problem. Great. What are you going to do about it? And this happened. I got fired 5 years ago, roughly 5 years, where a client said, I really just wanted to come in and bitch about stuff. You're not letting that happen. I'm like, yeah, because I think your quality of life could be better if you did some
Right.
shit.
Right.
And so I completely agree. I think other things happen too. Attraction to a therapist, I think, can be a huge deterrent from going. It can also be a way to keep going, but I think that plays into it. But I think you're right in that expectation really plays into it, that people really don't get informed about what they're going to have to do. It's about they're going to come in, you're going to take care of it for me. No, we're
Right.
not. We're
Right.
not. So yeah,
Right.
I'm with you on
You,
that 100%.
you know what's also a little mind blowing is the amount of
Hmm.
times that I've started with a new client and they just assume that I can also give them medications.
Yeah.
Is a little bit
Yeah.
crazy. I'm like, first of all, I'm a master's level. Second of all, even when I do get my PhD in clinical psych, I'm still not going to be able to prescribe you medications.
Yeah, yeah.
Um, However, did you know? I think it's
Ah,
Texas, and
yeah,
I'm actually okay. So this is going to be my question to you,
please.
since this came up. How do you feel about how do you feel about psychologists? So not medical doctors, but doctoral level PhD in clinical psychologists, licensed psychologists prescribing
Yeah.
medications.
Wow. Yeah, that is a big question. How do I feel about it?
How do you
So,
feel? What do you think?
well, Justin, I'm going to take the easy way out on this one. I think it depends on the person prescribing. Now, here's why. Because you
Sure.
know how different they all are in terms of their philosophy.
Yes.
I am fine. I am fine with it. Oh God, this is going to piss people off. If you spend more than 10 minutes with the client, I'm fine with it. If you get a good
Yes.
history, if you get a good if you collaborate with the therapist that's working with that person to get some additional data, I'm fine with you prescribing. What I don't want is the 10-minute interview and then here's your Lexapro. Okay, that's so maybe I answered that better than I thought I would. But you and I
Great
both
answer.
know we get the shitty ones who they don't take a family history. They don't even ask you what's going on in your life. I'm just depressed and anxious, and here's your Ativan, and good luck to you.
Right. Yeah. Yeah. The reason I bring that up is because I don't know how I stumbled upon it, but it was about a month ago. I think it's the state of Texas. They are considering, and there would be some um, sort of some classes and some things that even if you're a licensed psychologist that you would have to do, right? But
Sure.
it wouldn't be
Yeah,
a
no,
full yeah, it wouldn't be a full, medical residency program type thing. You're not going to have to go back to medical school. Um,
right,
but they, because there's such a shortage. I mean, there is a shortage of medication management providers.
right, right,
Um,
right.
and when you're a doctoral level, you got a PhD in clinical psych. I don't know. I'm a little bit biased, but I think you know a little bit more about mental health than the traditional psychiatrist, right? Because
Sure,
psychiatry,
absolutely.
you just so people know, your psychiatrist does not have a PhD. Your psychiatrist has an MD. They are a medical doctor. Which, by the way, do you know that when you open the front of the Diagnostic and Statistic Manual for Mental Health Disorders, the DSM, do you know like all but two are MDs that wrote that damn thing? All the authors. They're all MDs. All of them.
You know, I did not know that, but there's a crap load of MDs in there. That I'm going to have to look that up now.
Yeah,
Thank you
it's
for.
all MDs, I think, except with the exception of two. Um, and
Wow.
so when you use the medical model, they went to school, they're medical doctors, they are obviously trained on the medical model, and so these are the people assessing mental health. Which, let's be honest, mental health for a while was sort of a pseudoscience, right? It was sort of seen as a pseudoscience. We talked about this with Dr. Shermer. You
Sure did.
cannot you cannot take an X-ray or a CT scan and be like, "Huh, depression. I see it. It's right there."
Right,
I
right,
mean, you can
right,
compare scans to those that have chronic depression versus not, and see different parts of. I mean, yeah, but when you have cancer or you have a tumor, right? You can do tests. You can see it.
right.
Um, so so it's not the same. So, anyways, I got a little bit excited when I saw like Texas is doing that because like my I won't say her name, but my colleague who's very trauma informed, my mentor who does neuropsychs here in Minnesota from a trauma based perspective, would she prescribe meds? Probably not. She probably doesn't want that. But would she be good at it? Hell yeah,
Yeah, yeah,
because she gets it. So,
right.
um, yeah, I think that there's room for that.
No,
I'd love to prescribe meds.
you know, well, okay. Let me just throw this on the other side for a second. Um, Knowing how many bad prescribers there are, part of me thinks, do we want to have even more prescribers? So let's just look at it from
Right.
that angle, right?
Yes.
But Justin, in our field too, there's a lot of people that do therapy that aren't very good either. And so I can make that argument. So I don't want to let it go too far. But if you
Yeah.
take the
That's
top prescribers, yeah, if you take the top prescribers, yeah, some of them are fantastic. I've known some fantastic prescribers, but most of them are cookie cutter. they don't collaborate. I had a doctor many years ago who medicated two little girls. Maybe I told this story. Both of them freaked out because he put them on Ritalin when they weren't appropriate for Ritalin, and the parents both had developmental delays, so they didn't know what to ask. You think that
Sure,
doctor called me and asked me one question about symptoms or history? No. So to me, it's almost insulting.
sure.
But I find nurse practitioners, I don't know what your experience is, tend to be better at that than the
Yep.
MDs do.
Yep, I agree with you. I would agree with you. I mean, I've met a couple nurse practitioners, so I'm like Jesus Christ. But for the most part, yeah, I really I hear people come in and be like, "Well, I have a psychiatrist," and I go, "Okay, you might as
Yeah.
well Google your symptoms. You might as well like, I'm sorry." I'm sure there are some great psychiatrists out there, but I'm just not a fan. I really am not. And and
Uh-huh.
a big part of it I think is we get into we get it, this is with any field, with any career, we become part of the system, right?
Yeah.
And you work for a big clinic or a big hospital or a big agency, and you have certain expectations, um, and then you just start going through the motions, so I think that's a big part of it. I'm not a fan of psychiatry. My mentor once told me, if all psychiatrists were trauma informed and trauma trained, they wouldn't be psychiatrists. They would just be psychologists. Um,
Ooh. Ooh.
ah,
Oh.
yeah. Let
Oh.
that sit with you for
Mic
a
drop.
second.
Bam. Wow. I like you better caffeinated. You need to have those two shots of espresso every time.
Yeah, I don't think my patients or my wife would agree with that, but
Probably not. Okay. Am I next?
your turn. Yeah.
All right. So here's one you'll like. Does mental health therapy hurt one's chances of getting a job?
Ooh, God, I love and hate this question.
Yeah, right.
Um,
I know.
because the reality is, yeah, sometimes it can hurt your chances, right? Um, uh, it shouldn't, because everything is confidential. And when you go to apply for an employer or to an employer, like, they don't ask for your mental health history. They can't. They
Right.
can't. They legally can't.
They can't.
But if you go in there in your interview and you're like, yeah, and I struggle from chronic depression and all these things, and I'm gonna need some accommodations, they might just say they found somebody that was a better fit, but they might go, yeah, we're not hiring that person. Um, so yeah, I mean, I think it shouldn't, but I think that sometimes it does. Um, I know that we're in a culture of trying to destigmatize mental health. I don't think we've done a very good job of that. Um, yeah, I also, on a sort of maybe the other side of it is, if you really struggle with your mental health, I think that in and of itself is going to keep you from getting a job or being successful in a job. Um,
That's a good point.
I'm thinking about
That's a yeah.
Yeah, I mean, I'm thinking about somebody. I'm not even going to say who it is because, yeah, but
It's not me, is it?
it's not you. But I'm thinking about somebody like how. Okay, in general, especially when I did child protection, people could not hold down a job, right? That was just the reality. People, I mean, the reason why we have no rainforests is because people switch jobs every other day, and the amount of W-2s or W whatever that have to be sent out to these people because they had like 17 jobs that year, right? That's a
Right.
thing. And a lot of that has to
Yes,
do
that is
sometimes.
true.
It has to do with mental health, right? Like, I'm not feeling connected to this job. I'm not feeling appreciated. I'm feeling I mean, there's also just a lot of crappy employers. Let me throw that out there. But also, part of it is
Absolutely.
just a lot of it is. I was watching a TikTok the other day, that was saying, like, us adults, specifically us millennials, we're we might be 32, 33 years old, but really we're a bunch of overgrown 11-year-olds trying to
Mhm.
navigate this world, right? Because so many of us were hurt as kids, physically, emotionally. And that 11-year-old wasn't allowed to do this, wasn't allowed to do that. They had to, be quiet. And now we're adults, and that 11-year-old is still there. And so we're just a
Right.
bunch of overgrown, adult-sized 11-year-olds running around trying to parent, trying to work. And so I think in that sense, yeah, our mental health affects our jobs.
I like the way you said that. And let me throw this out there too, though. If you've got a mental health issue, being around people at a job can be very satisfying. It can be one
Sure.
of the best things you can do for people. Sherman, we talked about that too. Especially if you're traumatized, you don't want to sit by yourself because what are you going to do? Sit and listen to your thoughts all day? That's not good.
Right.
Um, and some mentally ill people can be very productive workers. Um, but I had a client many years ago who said, "Is anybody going to find out about this?" And I knew at that point that this person was scared. I said they shouldn't, but then I realized, well, shit, your insurance company can audit the file anytime they want to, but they didn't want to go private pay at that point. So, um, but certainly I think about the military too. I met a military kid last year at a oh, what do they call it? Chamber of Commerce get together. And he's asking
Sure.
about therapy. I said, well, what do you do when they ask you at the base? He goes, we just check all the boxes that say we're fine because they don't want to deal with it. And he made that very clear. And I've heard that echoed other places too. So it might be a bigger issue with the military than it
Yeah.
is with even your traditional job search. Yeah.
Well, yeah. Yeah, I
Yeah.
mean, I was listening to this girl talk the other day, and she's like, because people are worried about a a military draft coming up, because
Right.
of all of the shit and atrocities that are happening overseas, and you know,
Right.
um,
Right.
America has their nose in literally everybody's fucking business. But this is not a political YouTube
No,
channel.
no, we,
Um,
we, we, we didn't set it up like that today. I'm sorry.
but people were talking about the draft. People are really afraid of this draft, right? Because people aren't joining the military. People are
Right.
over it. People are like, no, fuck that. I'm not going to dedicate, and get all this trauma from going overseas only to come back and have shitty ass benefits. Um,
Right. Right.
like, and so people are like, people are, people were saying like, oh, well, I'm just going to put that I have extremely overwhelming anxiety, chronic
Mhm.
anxiety and depression. I can't be in the military. I might go AWOL. I'm a liability. So,
Right.
I think people, I don't know, it's just sort of a mess.
Well,
I don't. People need to go get help, though, right? I mean, this. If you're worried about it getting back to an employer, have that conversation with your therapist. I mean, all of that stuff is confidential. There's absolutely no reason why your employer needs to know that you're seeing a therapist. And even if they do know you're seeing a therapist, so the f what? you know, if they don't like the fact that you're seeing a therapist, maybe they should go see a therapist.
well, and let me piggyback that and say, I think we look at it like, well, you're going to a therapist, there's a problem. It's like, no, no, that's part of the solution. That's you taking
Right.
care of yourself by going to your
Right.
therapist. So let's look at it from that point of view.
And nowadays, if you don't have a therapist, maybe you're the problem, right?
Right,
I mean, if you're not
right,
seeing
right,
somebody and working, I mean, therapists see therapists, right? Because we are no perfect people. Our mental health isn't excellent. I mean, I fired the last four therapists because I'm just super picky and have my own set of problems. I can't find somebody I like or that I think is smart enough. That's my ego talking. But we're not doing that episode today either. Um, but
that's really good though. Yeah.
we're not perfect people. We need therapists too. So I
No,
think if you don't have a therapist, that's a problem. We could all benefit, even if it's once a month or once every other month.
absolutely. I had a client ask me at one point, do you see a therapist? I said, yeah. And you know what? I know there's this whole issue. Well, that's a boundary violation. Never came up again. You want me to lie to him? The client actually said, good for you. Right. But I think every therapist should see their own therapist. Absolutely. Even to go in and bitch for a half hour or an
Mhm.
hour. It just cleanse yourself, right, of all the toxic. So yeah, absolutely.
Yeah.
I think
Awesome.
you're up.
All
Nice,
right.
nice response, by the way.
Now everybody's gonna be dropping in
Yeah.
the comments, being like, "Justin, who's your therapist? Justin, are you seeing a therapist? Justin, I have a recommendation for a great therapist."
Yeah, right, right.
It's
Huh, huh.
it's why I do this show. Eric's my unofficial therapist. He
All
just
right,
doesn't
well,
know it.
let me give you my little shout out, Gremlin. It's almost Halloween, so there you go.
Perfect.
All
Um,
right.
Eric,
Yes.
how do you feel about the nature versus nurture debate? And do you think that the problem with today's youth is that we've gotten away from the nature part and all we're doing is nurturing?
Boy, that question sounds like a setup, but I'm glad you asked it. Yeah. I, you know, I didn't used to believe that biology played as big a role as I do now in the formation of personality and certain traits. But because I am a proponent of personality disorders, I do believe there's a lot of transmission. We're going to debate that later. I'm just putting that out there. But Justin, I also believe that the brain can keep growing and developing new plasticities and grow new neurons. So I don't think you're fixed with this is going to be your life path. But I think whenever something gets reinforced, here's what I've observed in almost 27 years of working with people. If you reinforce something, you get good at it. So if you reinforce shitty behaviors, you get better at them. You reinforce bad eating habits. I've done that. Anything you reinforce, you get better at. Now, do I think the kids of today get reinforcement that leads them to helplessness and entitlement? Yes, I do. I do. The data's there, Justin. It's there. Okay.
Hey, hey, this is your answer. I haven't even responded yet. You just
I
need
know.
to.
I'm just feeling it. But at the same time, I'm not going to blame just one thing because I think it's tougher to be parent in this day and age. And I'll let me go
You
ahead
know,
and justify this because everybody makes less money next to the economy. Prices are going up, wages are going down, or at least they're stagnating. And so parents, I think, are struggling.
yeah,
Look at the school system, Justin. We did an episode on that. We can't get teachers anymore. I mean,
right.
my God. So I don't think that's just the problem, but I think again, everybody's job gets harder, and we're going to see cracks in the system. And I think that's a huge part of what's happening with kids. I think kids don't get attention the way they used to. I mean, we could have a discussion about that. You and I think, are more similar than the 10-year-old of today, and that we at least got face-to-face contact way more than a
Hmm.
lot of today's kids do. So I don't know if that answered your question, but I hope it did.
Yeah, I loved it. I also love that your nervous system went into the fight or flight, and I all I did was smile.
Hey, hey, you know what? You know what? Here it is. Frontal lobe shut down, amygdala, bam. All right.
Yeah,
So, but I'm back to baseline. Thank you.
you're well, good. Yeah, no,
Yeah.
I agree with the vast majority of that. I also think that there's been a I so what about this?
Yeah.
Um, what about Gen Xers, baby boomers? Maybe they got too much of the nature, and they didn't have any nurturing, so they had quite the opposite of what today's youth is getting, and in an attempt to in a because the baby boomers or the Gen Xers, they're the ones that raise the millennials. Everybody wants to hate on
Right.
millennials, and yeah,
Oh, I know.
I'm
I
you
know.
I'm using the damn labels today because that's the kind of mood I'm in. But
Talk about
but
nervous system.
well, I can already hear the people. Justin, you don't use labels.
Uh,
Damn, we all use labels.
we all
Um,
use labels. Of course we do. Of course we
but
do.
the Gen Xers were the ones that raised the millennials, right?
Sure.
The boomers were
Sure.
the ones that raised the Gen Xers, and so
Sure.
there's a lot of heat that gets given on. I mean, the heat's getting onto the younger generation, which I'm like, great. But for a while there, it was millennials. Millennials are so entitled. Millennials this, millennials that. Well, I'm sorry, but who raised us? Right? It was the Xers and the boomers. Um,
Yes, it was.
and I
Yes,
know
it
a lot
was.
of millennials. I know a lot of millennials that grew up with their grandparents. So those would be the baby
Yeah.
boomers. And so I
Right.
think there's this pendulum shift that it was all structure, 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 do as I say, not as I do, don't ask questions, just shut up and fall in line. And I think that there's been this big shift to I don't want to parent like that. You be a free thinker. You do you. Right. And I think we're overcorrecting. Right. So I think that there's a lot of that has happened, and just this shift. I also think that for a while, not for a while, for a long time, the world, particularly our country, has just been set up like do as you're told. You don't ask
Yeah.
questions. You fall in line, and because you know what? That's how you keep people divided. That's how you
Right.
keep people in power. That's how you keep the poor poor and the rich rich. You keep people divided, and you don't have free thinkers. And I think the problem with that people have with millennials and now the younger generation is when you say entitlement, I hear free thinkers. I
I know you do.
hear people who want to do whatever the hell they want. And why should I just do that just because you said so? Um, and
Can,
my
can I?
yeah, go ahead.
I'm sorry. Can I cut you off real quickly? Okay, because I wanted to comment on this last time because I don't disagree with you in terms of the entitlement issue, but I think your generation you're not very good at saying, hey, let me at least see your point of view. That's my problem, is you don't seem very good at saying, you know what, I at least want to hear what the fuck you have to say. It's kind of like,
Sure,
nope. Okay. And that is a problem. And
but
you know it's a problem.
but let me ask you this. Come on now. Come on.
Okay.
Are the boomers and the Xers any better at being like, I've given you my opinion. Please, Justin, I would love to hear your point of view. Are they really
Well,
any better at that?
I, yes, I think they're better. I'm not saying they're perfect, but they're better. But they're better. Yes. Yes.
And that concludes today's episode of the Dark Side of Therapy.
But
uh,
yeah, go ahead. Yeah, go ahead.
no, I respectfully disagree with you. I mean, I
I
really
understand.
don't. I really don't think boomers and Xers are really any better at hearing a different perspective. For example, you know who runs our country? Baby boomers and Gen Xers. Like the vast majority of people in Congress are 70 plus. No matter what side of politics you're on, uh,
You weren't going to get political.
I'm just saying. And they don't want to hear the younger generation. Why do you think the younger generation isn't running the show? You got older people, the older generation, making decisions for me and my kids when they're not even going to be around in 10 to 15 years. you know, that to me Eric, doesn't scream. I would love to hear what the younger generation has to say about these things.
Yeah. Okay. Okay. So I think the problem you and I are both overgeneralizing probably the entire thing. Okay? Because we're both very passionate. Because and let me model for you what I'm talking about. I appreciate your point of view. I appreciate that I can come to this podcast and listen to you, even if I don't necessarily think that your facts are accurate. I appreciate because I can grow from this. Isn't that just killing you inside to hear that?
That's the most passive aggressive gaslighting bullshit I have heard in a long time.
Wow. 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 What would have made that seem more authentic?
Uh, if you wouldn't, okay. Oh, I gotta get back to center. This caffeine is. I need to go get some water. Look, I'm out.
Yeah, baseline, baseline.
But okay, let me sum it up.
All right.
My answer. I do think the pendulum has shifted. I think we need to get back into nature versus nurture, middle ground. There has to be a good combination of both, and I think we have shifted really far, and we do these hard shifts. We have to be able to have both. We have to be able to understand that some of this is part of that is wired in us. Some of it is we are enabling. Some of it is we're trying to do better than what our parents did. And also,
Right.
to your question of or to your statement about like millennials aren't really good about hearing other people's point. Yeah,
Yeah.
I would actually probably agree with that because for the vast majority of our lives we were told our opinion didn't matter, and now that we are voicing our opinion we're still being told our opinions don't matter because we're just being entitled. and we should not be so entitled. So you're right. I do think we make an opinion, and then we're like, and by the way, I don't want to hear you because you've told me all my life my opinion doesn't matter. So I rest my case.
Well, here's my final shot, and we're off it. Um, since apparently I come off like a narcissistic prick. Um, Obviously, I value your opinion, or we wouldn't be doing this. So
Yeah,
I had to throw that out there. But just it is a great topic, and I think because we're both so passionate about it, we probably need to have a whole episode just called the millennial versus Gen X versus millennial. Yeah, let's just do that, okay?
yeah. I'm probably gonna need to go into our sensory room for that because by the end
Right.
of it, I'm gonna be swinging in the swing with my body sock on.
Well, let me throw you a question that's not gonna make you go too swing happy here. Um, or no, are you asking? I'm asking, right?
Yeah, yes, your turn.
I lost track of the order. Okay, what are some of the worst things people have said to you and me, about your illness that they thought would help, but only made you feel worse? And let me say right now, I do suffer from depression, so I
Sure,
have an answer, but I want to hear yours first.
sure. Um, okay, like mental health illness.
Uh, yeah, and I think by illness we can break that down into even if it's just anxiety attacks or whatever. Yeah, but
Well, um, uh, I, I'm okay. My good friend, who I don't know if I can call him a good friend anymore, but um, I don't have a lot of friends. I don't have a lot of friends. I know that's surprising, but my really good friend, he he and I have similar personalities, and then for as similar as we are, we're very different. And a couple weeks ago, like I was really getting sort of cabin fever. I really need to get out of the house. I'm an extrovert, obviously, and I get my energy from being around people. At the end of a long week, my wife's idea of rejuvenating, getting her energy back, is binge watching Grey's Anatomy and cuddling up in a blanket. My idea of
good,
getting
good.
my energy back at the end of the day on a
Yeah,
Friday is going out with friends, hanging out. We don't got to get college wild, but hanging out with friends, hanging out out at the bar or wherever, right? My energy comes from other people. So I had been feeling that, and and I had messaged my friend, and it was later, and he's like, oh, whatever, whatever, excuse after excuse, um,
yeah.
and I don't know. I said something really snarky to him, and he got really offended, and his response to me was, that uh, I something like, you think you're just being funny, and your personality is such that you come across as an asshole, and you really hurt people's feelings, right? And the problem with that was, was he being truthful? Yeah. Yeah, that shoe fits pretty tight. um,
Yeah.
but uh, but the problem is that that's something that I've been working on for a long time, because I know that about myself, right?
Right.
Um, that my personality is, like, my office is not big enough for my personality, and that's overwhelming to a lot of people. And sometimes I'm joking, and sometimes people just don't want to hear it. I also think he was just in a mood that night, because usually I say things like that and he just gives me crap back. So that spoke to sort of that internal work that I've been doing on being more self-aware on how I come across and things like that. And he's not the first person to say something like that, right? My brother has said things like you're trying to motivate me. I know you're trying to motivate me, but you're really coming across as an asshole, and I'm not sure how that motivates most people. And that's hurtful, because I'm like, yeah, you're right. I am trying to motivate you. Um,
Right.
and
Right.
apparently I'm not doing a good job, right? So those are, I don't know if that's what you're asking, but like that's where my mind went, and those are some of the things um, that internally, like personally, I've been trying to work on, and it comes out sometimes, and people respond, and I'm like, and then I'll go down a rabbit hole,
Oh yeah,
So,
then that self talk kicks in, right?
oh yeah, yep,
I appreciate that you shared that example, and well, you and I share what we call the sarcasm gene, and we sort of function through smartass comments, but probably a lot of that comes through some degree, I think, of insecurity at times, maybe, but also that we believe humor's the best therapy in a lot
sure.
of ways. So I get it because I've heard similar things, but usually for me, it's just I'm inappropriate. But let me tell you what I was told by someone 4 or 5 months ago. I think the direct quote was, "I can't believe somebody like you has depression," and
Hmm,
I really had to step back and I thought, huh. So I guess I don't fit the profile of what somebody with depression looks like. I mean, in terms of job, personality, and then I'm reminded of the people that killed themselves, like the Robin Williams of the world, the Kurt Cobains. You know, um, you can have everything but be depressed. Having stuff and success does not cure depression, and it doesn't. Um, but it was I had never heard that before, Justin, from anybody. Somebody like
sure,
you, yeah. And it wasn't a statement of endearment. I can tell you that.
sure, sure.
Yeah.
Uh, yeah, I mean, it's why I try to be as authentic as possible in here. And for some clients, have I had clients after the first or second times go, yeah, not going to be a good fit? Yeah, I'm thinking of a
Right.
mom. Um, most of it is her own trauma she hasn't gone through, but she didn't like what I was having to say. She didn't like the fact that I mean, I won't get into all of it, but I was being my authentic self. I was being real. And and am I some kind of um, super genius? I mean, no. I'm good at my job. I have a lot of knowledge, but
Absolutely.
I'm not this like world renowned therapist yet. I'm not
Right. Yeah.
some I'm not Dr. Bruce Perry. I'm not Dr. Gabor Mate, who I know you
Right.
absolutely love. Um, but
I'm not gonna let that shut me down.
I'm not some of these, really big names and really wise people. But
Yep.
people come here. I mean, we have a lengthy waiting list because, and one of the most common responses or feedback that I get from parents in particular is we appreciate how real you are, Justin. We
Mhm.
appreciate that while we don't know the random shit that will come out of your mouth,
Right.
we do know that it's going to be raw, real, and genuine, and you're not going to
Right.
sugarcoat us. Like now, those are the common things that I get, and people appreciate that.
I
And
love it.
so I feel like that maybe sort of enables me a little bit to continue to be an asshole, but
Well.
also I don't, personality for me, what I know about personality, that's at our core. That's for the most part hardwired, and you
Yeah.
can do some work on being aware about it, um,
Right.
but you're not going to change those hardwired personality factors and
Right.
features.
You're right. But that's where I think you have an opening to say to a client, I have some things about me. Like I tell every client, I got a big personality and I can be abrasive. But I think if they know that going in, I think the problem is when the therapist has no self-knowledge and they just kind of do their thing. It's like, no, you want to let clients know what they're getting into.
Yeah,
Um, I'll tell you why I think clients stick with me in therapy because we laugh together. I honestly think if I didn't laugh with people, I don't think I'd have a career, Justin.
sure, sure, sure.
Uh, how is that for honesty and transparency?
Yeah,
Yeah,
I love it.
yeah.
I yeah, I love it. Um, what y'all don't know is before we got on air, uh, Eric called me arrogant. So, and then a few seconds ago, he just called me abrasive. So now I'm both arrogant, abrasive, and an entitled millennial. So,
Wow.
all right, Eric,
Wow.
here's my next question for you.
All right. All right.
Is there a difference between feeling depressed and having depression?
I would say a qualified yes.
And what is that difference?
Meaning, well, I think let's use an example of grief, for example. I think depression that is associated with grief is not having depression; it's a function of the grief you're going through. And I think some things are going to naturally depress you. You lose a job, that's pretty
Hmm.
fucking depressing. You lose a relationship, that's pretty depressing. But I don't think these things mean you have depression. I look at depression really as sort of a lifelong thing. You never really beat it. You just learn to live with it and cope with it, and it never really goes away. Some people may disagree. Um, but no, I think to me that's the difference. Now, society looks at it like something bad happened. I have depression. I have it.
Right.
I have it. I have it. No, I don't think you do, because I think real depression is enduring, and you learn to live with it, and you can still have a very functional life. I think I'm doing that, but that's my short answer.
So let me ask a follow-up question that digs a little bit deeper.
Please,
Do
yeah.
you do you think that do you think that that is why, for the vast majority of people, why antidepressants do not work, because they do not have true depression?
Um, yes, and I think there are more people with personality disorders walking around than we give them credit for, and they don't work on those people either. Um, I look at medication by and large as I want to numb myself to the natural pain I should be feeling as a human being.
Mm.
There it is. Yeah.
Yeah, I had my same mentor. She's gonna send me a cease and desist letter
Yes,
soon. Uh,
probably.
it's okay. I know she doesn't watch YouTube. Um, uh, uh, she'll be the first person to tell you that she does not like technology. But anyways, um, she very often when we would be doing our sort of follow up meetings or whatever with the clients after after doing the neuropsychs, she would say that, like, I can't tell you what to do with meds. I'm not a medical doctor.
Right.
However, in general, when somebody doesn't have true depression, that's why your antidepressants aren't working, right?
Right.
Because
Right.
and that's why people who are on antidepressants, that's why there's all these warnings. If you start taking this medication and you feel more suicidal, you start having these things. Yeah, because I mean, there's multiple factors, but also we cannot use depressed, feeling sad,
Yeah.
synonymously with depression,
No.
because it's not the
No.
same thing. Their clinical depression has its
Right.
own set of criteria, and
Right.
and if you talk to somebody who has genuine depression, who struggles from depression, I mean, I'll go out there and say this: I genuinely think that I have an undiagnosed bipolar disorder, because in those periods of my lows, that is depression. Like I've never have I been. Do I get sad about things? Yes.
Yeah.
Is it the same as when I'm in those lows? Absolutely not. It is a totally different feeling. And so when you talk to
Right.
somebody who has
Right.
true depression, they'll say the same thing. It's not the same thing as losing your cat, or losing a family member. Yeah, that's sad and depressing as hell.
Right.
But it's
Right.
not the same thing as having true depression. Can true depression stem from losing somebody or a big event like that in your life? Sure. But I think people need to be more self-aware when they're sort of just throwing these terms out there, because it's not
Yes.
the same thing, and
You're
it's
right.
harmful.
And you and I agree. Well, in the same way that trauma is not the same as post-traumatic stress disorder.
Right.
Those are all, but that's another episode too. But
Right.
the problem is, Justin, that I go back to the old Jurassic Park, we let things get out of control. So everybody has access to this terminology, and people are going to bend words and phrases to meet their needs. It's going to happen. And
Yep.
and that's one thing that we really screwed up in mental health is we gave people access to everything. So
Yep.
now, I mean, think about the commercials. Ask your doctor if this is right for you. Well, who the fuck are you to be asking your doctor If anything is right for you, you're not the expert, but we just put the power in your hand.
Right.
Just think about that.
I,
But no, that is, yeah,
100%.
yeah.
100%.
Great question. Okay, I guess again, I am going to have to check out at 12:30. So here's the last question today: is mental health therapy based in pseudoscience, Justin?
You would leave this last week. I purposely left out the personality disorder question.
You know what? You'll get me eventually. Come on.
It is mental. Okay, read the question again, please.
Okay, is mental health therapy based in pseudoscience?
I think it depends on what your definition on pseudoscience is. Um,
Uh-huh.
are you ready for this?
I'm ready. I'm ready, man. Hit
I,
me.
I sort of, I think I said it, or at least alluded to this when we were talking with Dr. Shermer, and he flat out said, right? His
Yeah.
comment was, "Wow," and that's coming from somebody who works in the field, right?
Yeah,
Um,
right.
because I think I said,
I do remember that.
in large part, psychology is made up. Um, you trace its roots back to the founders, right? Like Freud. Um, it was things that Freud was observing and coming up with on his own. And back then, I mean, people are still impressionable. People will still you post shit on Facebook, and people are like, "Well, look, it must be
Yeah,
true."
I know.
So people are
I know.
still very easily persuaded, and and that was the case back then. I mean, in one of my history and systems classes, we talked about I forget what the therapy was, but it was like cranial therapy, right? And they would literally feel your skull, feel the top of your head, and
Mhm.
the bumps on your head, certain bumps on your head meant certain things, right?
I have heard
Um,
of this. Yeah.
yeah, and that was believed for a little while, and then turns out that's a bunch of bullshit. I forget who the guy was. He started in like California, and then he ended up on the East Coast, and then now he's just crazy.
Yeah.
But he was the one doing lobotomies, right? He was like, "Oh, your kid has tantrums, and your kid this come bring them in. Let me put this pick through their cornea, right, or whatever this is, and let me just and scramble around in the brain a little bit. Fixed."
Right.
Um, that
Right.
was a legitimate. Do you know that lobotomies are still technically legal in most states?
I didn't know that.
While
I'll be
not
damned.
while not practiced, you could still stick a thing between somebody's whatever this is part of their eye and scramble their brain around a little bit, and that's legal.
Well, isn't that called the
Anyways,
death penalty?
yeah. So
Interesting. Yeah.
and what is everything called, right? Cognitive behavioral theory, polyvagal theory, um,
Yes.
so on and so forth. They're
Yeah.
all theories, right?
Right.
And
Right.
um, what is the definition of theory? I'll read it to you.
Please.
According to the Oxford Dictionary, a theory is a supposition or a system of ideas intended to explain something, especially one based on general principles independent of the thing to be explained. So, or an idea used to account for a situation or justify a course of action.
Yeah.
So,
Yeah.
so YouTube viewers, it's not fact. It is not hardcore science. Um,
No.
I think we have evolved. I think that psychology overall is valid, but do I think we have so much more room to grow and evolve? Yes. Do I think it particularly was founded on pseudoscience? Uh, yeah.
Well,
Yeah.
yeah. uh, for something to be truly scientific, first of all, it has to be truly measurable and it has
Sure.
to be repeatable. Okay, though those are two really big criteria in science. And mental health, we don't have any of that, at least to a statistically significant degree. Now, the CBT people will say, well, of course we do. We have these huge ass studies, but you can pay for huge ass studies. most of the other interventions don't have the kind of money they do. And I heard somebody quote that directly. Um, I think it also comes down to how are you measuring progress as well. Because everybody that does these little scoring things, it's all based on that day, how they feel. It's not like we're brain mapping everybody to death here, Justin. And
Hmm.
even if we do that, that's not reliable because I think my brain probably maps out like a serial killer, I would guess. So pseudoscience might be a really strong a phrase, but what I will say is therapy very scientific? No, no, no. It's not. I mean, think about the hardest sciences we have: physics, right? Even biology is not considered the hardest of sciences. So how can mental health be considered the hardest of sciences?
But even physics is made up bullshit too, to some degree. I mean, you got physicists talking about string theory and all these. I mean, there's
Yeah,
still theories out there. They get paid hundreds of thousands of millions of dollars to say like,
yeah,
oh, we were completely wrong. Actually, black holes exist because blah blah blah. Right? I mean, so
no.
it's across the board. Does that mean that therapy doesn't work? No, that doesn't. I think I honestly, here's my theory.
Yeah.
The best therapy happens when you make connections. At the trauma conference that I did, I quoted Dr. Bruce Perry,
Hmm.
and I don't remember the exact quote, but I just said the best. He essentially says the best healing agent for trauma or really any mental health problem is connection. Connection with another human being. Safety and connection are the best healing agents. And if you have a therapist who is genuine, who you can connect with, who you can feel safe with, I think that's why therapy works in large part. A lot of the other theories and a lot of the other skills, yeah, those play good roles, but
Yeah.
without connection safety, therapy doesn't work.
Um, and we can trace that back to our tribal history. If people will make that leap. But I'll leave on my favorite quote by Dr. Greg Lester, who said, "You can help anybody whose pain you can get a hold of."
Yes,
I really, I
love it.
really, I really like.
Um,
Um,
hold
Thank you
on.
again. It's on to
Wait,
you. Yep,
wait, wait,
yep,
wait,
yep,
wait. We have
yep.
a couple minutes, and I got a really short. This question is really short and simple.
Okay, yeah. Forgive me for trying to just take it over here.
Do you believe dissociative identity disorder is a real diagnosis?
No.
I was I was just kidding. That's not actually a short question because that's a loaded question.
It
Um,
is a loaded question.
which DID,
Uh,
for those of you that don't know, dissociative identity disorder used to be known as multiple personality disorder,
right.
um, and there is a lot of debate within the psychology field, uh,
There is.
and whether that is real or not. So,
Right.
yeah. Anyways, I was just
Well,
half joking.
no, I appreciate it. And that might be one that we come back to as well. Well, I guess since you did the intro, I'll do the outro. Thank you again. And a great episode today. I really enjoyed that we were both caffeinated. I think that helped. And just quick shout out for Candace, my partner that I present with. We'll be at Evergreen in Bemidji November 1st. Come out and see us. And Justin, again, thank you for all you bring to the show. And I am saying this with heart and honesty because I really enjoy what we do.
Well,
Please like. Yep.
there's a different inflection in your voice this time. So I believe you're being genuine.
Yeah. I'm so glad that's coming through. But as usual, if you like us, comment, like, subscribe. We want to have you on board with us, and we want you to be honest in terms of what you think, because we'll change the format if we need to. You tell us what you want, and I like that you're on Facebook asking for people to ask questions. I'm gonna see if I can gather some questions too from some folks that I know, because those are the fun ones when people ask questions that we know. But today I felt like yeah, we had some good questions between us. Is what's
And
nice.
live, I think like if we were to be asked questions on the spot, that would be really
I
fun.
totally agree.
You and I will talk more about this, Eric, but I do want to throw this out to our viewers. I threw it out on Facebook. I would love to, you can schedule an event on Facebook, um, and so we could schedule a live, and we could let our viewers know,
Yeah,
next
yeah,
Tuesday at 11 o'clock or whatever the case may be, right? That we're going to be doing a podcast episode, and it'd be like part 3 of this. And so I think that doing something like that, and then you can take that and you can put it on the YouTube channel. So I think that that would be really cool. It could hit another audience, and we're not famous YouTubers yet, but we'll get
Yep.
there. So I think that that would be really cool because I think when I first signed on, what I heard you saying, Eric, was the goal is to talk about a lot of things that aren't talked about in the mental health field, and also reach viewers that maybe feel sort of left out, especially new
Mhm.
clinicians,
Right.
and those people. So I and sorry, I'm going to interrupt your outro here for just a second. I got some
Sure.
really good
Sure.
feedback from my kid's teacher about you, Eric. She's like,
Oh,
hey, it was like a week or two ago. I was dropping off my daughter, and her preschool teacher came up to me and said, "Hey, I started following your podcast." She said because I knew what your job title was, but I didn't really know what you did, and this sort of helps me to understand like what you do. And she said, and I really enjoy your co-host. He seems really authentic, and I really like the things that he has to say. So I've been meaning to tell you that. Now I've told you that publicly. Don't let that go to your head. Um,
never.
you need it to fit inside your snow cap for when you go shovel more snow. So, but no, we're reaching another set of audience, and I think it's really fun.
That's
It's really
awesome.
cool, and so watch for the
Wow.
Facebook Live. I do think that that's something we can consider, and would be something really fun. So,
Yeah. Thank you very much. No, it just it always warms my heart when somebody gets something out of what we do. I mean, that's why we do it, And
yep,
I agree. Reaching a broader audience is very exciting to me. So thank you for all the mean things I've said to you today. Thank you for saying something nice to me.
you're welcome.
All right, everybody out there in internet land, we will see you next time.